Today, in this video, I am going to talk about the 12 cranial nerves in our body system, and I'm going to talk to you about the functions and what can happen when one of those nerves is not working properly. The first cranial nerve I'm going to talk about is the olfactory nerve. The olfactory nerve is located under the nasal cavity. And what it does is to control the sense of smell. And how can you assess it by a patient for that cranial nerves? What you can do is to have the patient close both eyes and you bring up some object, ask them to identify the smell. Now, you are my patient. I can, be gladly ask you, what kind of smell is that? Under your nose, the first nostril, the right nostril. Can you smell it? Yeah. Wow, it smells good. Oh, it smells like apricot. What is it? Body lotion? That smells like apricot? Oh yeah, you're right. And then you switch to the opposite side. So what about this one under the left nostril? Can you identify the smell? Oh, sure. This one look familiar. It smells familiar, more familiar than the previous one. This one is definitely hand sanitizer. You got it. It's so nice. You can identify both of the object smell. Because the patient can identify them both, that means both nostrils work. There's no problem in the olfactory cranial nerves. Now, moving to the next one, that is the optic nerve. The optic nerve, when you say optic, you see something that is related to the eyes. The eyes, when you go to the doctor, you see optic. You see the picture of the eye, the glasses, stuff like that. So how can you access? It's located at the back of the eyelid, the back of the eye. And what it does is to carry the visual messages to the brain. Whatever you can see, you can identify it with your eyes, and the brain record it. When you go to the doctor, the eye doctor, what they do is to have you point at something. The doctor point at something on the board and ask you to close one eye and to identify. It could be a number, a letter, or a color. So what I'm going to ask you to do is to close your right eye and look at the board and tell me what you see. What do you see on the board? I see letter H. Oh, good. So I change the slide. Now you're going to close your left eye and look at the board. I change the slide. So now, what color is that object on the board? Oh, it looks like blue. Exactly, you got it right. So because the patient can identify the object on the board with both eyes. So that means that cranial nerve is in good working order. There is no problem at this point. And then we can move to the next one. The third cranial nerve is the oculomotor nerve, or both previous nerves are sensory nerves. And the oculomotor nerve is a motor nerve, like it says. It's related to the eye too, but this one is for the eye movement. The eye movement, how can you access that nerve? You can ask the patient to keep the head straight, and then you bring up an object, and then you tell the patient to turn the eye to the left, to the right, and to the left, and to visualize the movement to see if there is any pupil constrictions, to see any pupil dilation, stuff like that. If you don't see any difficulty focusing with the eyes, so that means there's no problem in that cranial nerve. And if there is any problem, if there was any problem in those nerves, that could mean the patient could be blind, or the patient might have cataract or any other eye problems. So now we're moving to the fourth cranial nerve, which is trochlear nerve. The trochlear nerve is a motor nerve. It's motor nerve, and it's only deal with one muscle, that the superior oblique muscle of the eye, the superior oblique muscle of the eye, that help you to look down when you can, especially you can hold both eyelid, and then you tell the patient to look down, and then you can access that cranial nerve to see if they're working properly. If you see they both equal, there is symmetry, so there is no problem in that section, because the patient is able to move the eyelid down. And that way we can move to the fifth cranial nerve, which is the trigeminal nerve. That is another motor nerve. What this nerve does is to sending messages. The temperature, the touch, and the feeling. You can feel, you can touch, and you can, feel the pain. Either you can touch from the face, you can feel the touch. You can have, when the patient talking about the pain, that the feeling of the pain, it could be something interior, not the pain you can, or if something happened in the body, you can, feel it too. You can touch it. So all those things are part of the trigeminal cranial nerves, and it helps also with the chewing and the swallowing. The chewing, the swallowing, all those things. You can palpate, you can touch, and then you can feel, okay? And if the patient doesn't have any problem swallowing, like, or difficulty swallowing, dysphagia or whatever, or that means this nerve is in good working order. And the sixth cranial nerve we're going to talk about is abducens nerve. The abducens nerve is another motor nerve control the function of the extraauricular movement of the eye. What can you do with this cranial nerve is when you tell the patient to keep the head straight up, to keep the head straight up, and then you bring something in front of the patient, and you tell the patient to to turn the eyes to the right and turn the eye to the left to see if there is any pupil constrictions, to see if there is any abnormalities. And that way you can see there is no brain damage if this can be done without problems. And the next cranial nerve is the facial nerve. The facial nerve is the brainstem nerve. The brainstem is located in the brainstem, and it controls the facial expressions and control the muscles function of taste using the tongue, the 2/3 of the anterior tongue to taste. And it controls also the tear production when somebody is facing a tough situation and then the person cries, the tear come out of the eyes, and then this is the nerve that controls that, the facial nerves. Okay? And we can move to the next cranial nerve, which is the vestibulocochlear nerve. The vestibulocochlear nerve is a sensory nerve. It's a sensory nerve that is responsible for the audio. It transmits the sound from the ear to the brain, the information, the sound. When you hear something, you listen to the music, you listen to any sound. When somebody slammed the door, boom, or somebody hit something, or a crash from cars, you hear all the sound, all the people screaming, stuff like that. Ah! You hear all of that. So the nerve that is responsible for that is the vestibulocochlear nerve. So if there is any damage from that nerve, it can cause hearing loss. That's why people can be deaf, and now they're going to need hearing aid to facilitate hearing. And the next cranial nerve I'm going to talk about is the glossopharyngeal nerve. Glossopharyngeal nerve is located at the medulla oblongata, and it goes all the way to the pharynx. What it does is to coordinate the movement of the senses that control the body. Any impairment of that cranial nerve can cause an electric shock. It can cause pain. It can cause sore throat. It can cause us tonsil and ear pain. You can have earache. All those things are related to impairment of the glossopharyngeal nerve. And the 10th cranial nerve I am going to talk about is the vagus nerve. The vagus nerve is related to pneumogastric nerve. When you say pneumogastric, that means something related to the lungs It controls the heart, the lung movement, and the digestive tract, and it prevents stomach from emptying properly. Any impairment prevent that cranial nerve to have the stomach empty. So when the stomach cannot be emptied, so it causes constipation. And if you don't solve that problem, so it can lead to any other, a major, you know, a major health problem that can lead to hospitalization or even surgery. And how can you assess the glossopharyngeal nerve? Is to check as the patient if they feel any pain. You can osculate, or the vagus nerve. Yeah, you can osculate the lung and the tract to feel any. How you can access the vagus nerve is to lie on your back. Look at I lie on your back and look with your eyes to the right and switch to the left to prevent you know this from happening. You need to be mindful. And the next cranial nerve I am going to talk about is the accessory nerve. The accessory nerve is located in the brain. What it does is carry the information from the brain to the head and the neck and to the entire body parts. They are present in both sides of the body. How do you assess it? Is to ask the patient to turn head to the resistance hand. You make a resistance with one hand, and then you ask the patient to turn to see if there is any weakness, any sign of weakness. If you do it for one side, and you got to do it for the other side too, to do the same thing, to assess both sides. And you ask the patient to turn toward the resistance to see if there is any difference between those two. And after you assess both and you don't see any difference, so you can conclude that cranial nerve works good. And last but not least is the hypoglossal nerve. The hypoglossal nerve is a movement responsible for the movement of the tongue. You can assess it by asking the patient to stick out the tongue, and then you inspect for any atrophy. You inspect the tongue for any atrophy, any fasciculations, or any weakness. Any weakness. And if you notice any of those symptoms, it could be uh, a sign of getting to a paralysis state. So I hope that this video about the cranial nerve was helpful to you for your knowledge to make you understand what function they play in our body system and how to assess them. As a nurse, when you have patients coming to you, you need to know what those cranial nerves do. You need to know the sign, the symptoms that attach to those cranial nerves. Thank you. Have fun.